I've got Dr. Lorena Lee here. We're in Solana Beach, wanting to pick her brain a little bit on Chinese medicine, some takeaways for you guys, and also how she, as a level 2 foundation training instructor, likes to incorporate things into her personal practice. So let's first start with you, Lorena. Tell us a little bit about you, where you grew up, and got your education, all that.
Okay, so born and raised in New York City in Chinatown.
Very different.
Very different, yeah, than California and even San Diego. And I got my bachelor's in finance and economics, thought my role was supposed to be in finance. And I worked on Wall Street for 10 years. And then I
had no idea. No, sorry, keep going.
And I was seeing an acupuncturist at the time for stress. And one of my stress relievers was Muay Thai and Jiu-Jitsu. And so my neck was always getting cranked. So I was going to acupuncture to relieve all my tension and get zenned out. And so that's how it all began. Then fast forward, 2009 was the mortgage crisis, and I was really contemplating my life because everybody else was getting laid off. So I decided, I really love my acupuncturist and I really love how she's helped people. And I was sitting behind a computer working on spreadsheets, and so I decided to take the leap and go back to grad school. And so I got my master's and also my doctorate in Chinese medicine. And I moved here because sports medicine, I wanted this internship really bad at UCSD, and it was here, and I thought I was going to be here for one semester, and 10 years later, I'm still here.
Nice. So with that transition, how has it been? Like, kind of give an explanation to everybody, the differences maybe between Western medicine and Chinese, and then maybe some of the similarities.
Okay. So Western medicine is great. We need it, but it's more scientific, and also, for pain relief, it can help, and surgeries are necessary. But with Chinese medicine, it works more at the root and from internal to external. And I found my mentor in San Diego, Matt Callison, and he blends both. So we do a lot of orthopedic testing and see it more from a little bit of a Western perspective, but also intertwining it with Chinese medicine and seeing it through meridians and channels. So it's quite fascinating to see it from different angles. So that's why I really like it.
Yeah. No, it's awesome. And what you make me think of is the idea that I've heard time and again that Western medicine really addresses the symptoms. I mean, amazing when you need a surgery, when you got to go to the ER and a limb's falling off. But so often, I'll use myself as the example of, they go to the symptom and they want to treat it and give you a pill, give you a med. And like mine, attention deficit disorder, they would just take this med. Not let's get to the bottom of why that's happening. We talked with a doc just the other night before I left San Diego, and while he was in medical school, the laundry list of medications that he was on to counteract the results of other medications that counteract stress, anxiety. And so when I look at that versus Chinese medicine, where it's let's go to the root of what's causing the symptom, I find it to just be, a fascinating story. And I've been reading a little bit about the early 1900s when essentially Eastern medicine started getting pushed out of America at the early stages of it even coming in. Really, really interesting stuff. So how did you find foundation training? Like, how did that come into your practice? And then I'll ask you a few more on it.
Okay. So I belong to the San Diego Surf Ladies, and it's a women's surf club. And there was a class in Oceanside, which is 45 minutes away without traffic. So it was always during like Friday night, a lot of traffic, and I could never make it up there. And I just started Googling like foundation training and finding out that it's great for any kind of low back pain or pain in general with spinal and even neck and posture. And that's where I, dove in deeper, watched the YouTube videos, the TED Talk, and it's like, I'm just gonna take the certification program.
Yeah.
And so my first time experiencing foundation training was Active Cert.
That's awesome. What was your first takeaway? Like, how did you feel after the first workout? I don't know if you can recall, or like, how did you feel at the end of the? You remember, please.
Oh God, yeah. So I brought my surf buddy with me, and I remember coming back to the hotel after the long day, and I was like, wow, my torso, I feel so much taller. Petite, by the way, but I felt so tall, and I felt like my digestion had so much more room, and I just felt lighter and more aligned.
Yeah, awesome. It's always interesting to hear people's first takes. I know mine was just this overwhelming, like, what the heck is going on? And it's always fun. So how would you say bringing foundation training into your practice has influenced you as a doctor of Chinese medicine?
Okay, so I'm all about using all different kind of tools, right? So, but the biggest thing I find in everybody is nobody's breathing. Everybody is either shallow breathing, hunched over a computer. I have a lot of people working on their laptops or computers, on their phone, and it's closing in on their breath. So integrating it that way, making sure that they're breathing. And when we were doing treatment, I put in the needles, and then I have patients breathe in that perspective too. So
yeah, you did a lot with me today, and we're gonna hopefully be plugging in some of those clips along the way of the acupuncture and the cupping, and just we were talking. I mean, we ran out of time because as we got in there, she realized she bit off more than she was ready to chew. With me, it's been, and I didn't even think about it. I was telling GC when I walked out, it's probably been 7 months since I've really been worked on. At the start of COVID, it's all been me taking care of somebody else and other people, and so doing my practice. But I think it always goes back to the idea of, foundation training is one tool in many, and that we've got to be doing the work. And it doesn't mean we don't need to see our Chinese medicine doctors. It doesn't mean we don't need to see our massage therapist or our chiropractor. And today we were just discussing how beautiful of just that complement of chiropractics and Chinese medicine together. And then you splice in a little FT on the side. And it's a powerful treatment session right there. It's a reset.
Yes.
I felt completely reset when I left. Like a degree of stress and tension that I didn't even realize I was carrying had been lifted off, and I could say in the most simplistic format, all you did was drop needles in it, but there was a clear scientific method going on, or a very calculated process.
Yes.
I don't know if you could speak to that at all, of like, as you're placing those, where your mind is or what you're looking at.
So Chinese medicine is qualitative, but also methodical. So when I do see your body, I see it, I see different pathways, and then where you show me where you have pain, I also focus on that, like what you're coming in for is really important besides other things.
Right.
And then the foundation is similar to foundation training, where the hips and the pelvic area, that's foundation for us too.
Yeah, awesome. I love that correlation and connection. So what about how has it changed your movement practice or health in any sense, like your personal practice?
Okay, so I see it in everything. So whether I'm practicing on a patient, I'm using the same, I was doing the founder, right?
yeah, he was working on it. We got a photo of that.
Whether surfing, walking, putting dishes away, every movement, I really focus on making sure that my whole body is in a correct posture.
Yeah, integrated in that practice coming out. And I thought it was awesome watching you go into it, because it happens without thought. When I look at that, as I started to really look at the correlations of foundation training, we'll maybe say like traditional martial arts, where it's more about this embodiment of a practice, not so much this combat mindset.
Exactly.
Yeah, and really how you, and I'm going to steal this from another one of our instructors we're going to interview, but as he said, like jiu-jitsu, foundation training becomes a part of you, that you don't have to think, you flow and you go into these things without a thought. And I look at when it starts to just come out with an integration in life, and as you talked about through COVID, treating a lot of patients, having to be very aware of how often you're looking down. And so you start to bring this awareness to your life and your practice, and I feel like even to a degree an ownership of, I know what my body needs right now to get back to a balanced state.
Yep.
You know, and so I love that. But what about when we start, you know, I had a few other ones I wanted to hit on, but I really am curious when it comes to you, and how do you define wellness?
Okay, wellness. Wellness to me is quality of life. And it's going to be, just like how you were saying, it's going to be for life. So it's not a sprint, it's a marathon. We have to learn how to use our bodies, because everybody's different, right? Your body's different from my body. And so I have to learn how to find that balance for my wellness.
I love it.
And then everything in moderation. Everything is connected with your mind, your soul, how you feel about things, and how you're using your vehicle.
Yeah.
So.
Yeah, I cornered her when I came in, and I made her be very honest with me about my coffee, which you guys have probably seen by now. And when I left, I remember feeling like I don't even want this, and I dumped it out. And we got back to the house. I took a nap. I did a very short meditation, some grounding, and I came inside. I go, I just want some hot tea. And it was almost as if the whole reason why I was stuck trying to stay stimulated was a little bit alleviated, you know. And I was telling him, I try to process like all the feelings afterwards, like that, you know, after a powerful session. So now I had one more, and this one came from Allie.
Okay.
And really I should just say me, but Allie wrote it, and I'm going to let her own that one. What advice would you give for the individuals out there?
Okay.
I mean, you've given tons of bombs.
Yes.
I hope that you guys are picking up on here and maybe taking notes. But what other advice would you give, and any powerful things outside of the foundation training box that you would tell people to invest some time into getting good at?
Okay, there's a lot of questions in
Yeah.
there. Okay.
So let's start with Allie's first. Advice that you give individuals.
All right. So the most simplistic is to breathe, because I notice almost like a lot of people just don't breathe into their rib space. The whole thing, everything is connected. And so when also there's different types of breathing. So there's belly breathing, and then there's, foundation training breathing. I think there's this stigma of everybody should be belly breathing, but I think remembering to breathe also.
Awareness of the breath. It is such a tool, you know, and I love that you bring it up, because we reinforce it, but it's always better when it's not me saying it, you know, and you're coming from a very powerful place.
Thank you.
And then what about other practices that you might tell them to really bring into outside the foundation box? Now, I know obviously we don't own breathing, but what other tools might you throw on and they can do at home?
I think they need to stop, right? Just pause, because we're in this like go mode, and we forget to even just like close your eyes, see where your body's at, what are you thinking? Kind of check in with yourself. Some call it meditation.
Love it.
But just do a body scan. You don't have to label it meditation.
I don't have to sit on a cliff and cross my legs and do something with my fingers to get there.
Yeah, and then take a few breaths with that. Right?
Power combo. Love it. Lorena, that was awesome. I don't want to drag it on too long and start going in circles, but any last things you'd like to leave them with? Anything else? Are we on a good place right now?
I think we're good.
All right.